School is back in session and fall sports are already underway. Dr. Linda Neeson, Dean of the College of Dental Medicine and Vice Provost for Oral Health Affairs at KCU's Joplin campus, joins us today to talk about the importance of protecting your mouth when playing sports. Thanks for joining us, Dr. Neeson.
Thanks, Bobby. It's always a pleasure to be with you.
Well, we're grateful you guys can take time to come and talk to us about issues that involve health, dental health, medical health. So when it comes to talking or protecting your teeth, mouth guards are essential. Talk about that.
Mouth guards are essential, and what's interesting is we see people wearing mouth guards or having, some sort of tray in their mouth for a lot of different reasons. Mm-hmm. So I categorize mouth guards in 5 different ways. So you think first, there's a whitening tray or a mouth mm-hmm. guard that people wear to whiten their teeth, and a lot of people are familiar with that. Then you have people who are wearing aligners to straighten their teeth. Mm-hmm. Braces have now gone from bands to aligners. Mm-hmm. Then you see mouth guards for sports. So we'll talk about sports mouth guards. And then you see people who grind their teeth wearing a mouth guard to protect the enamel, mm-hmm. usually at night if they're grinding or clenching. And then people can wear mouth guards for sleep apnea. So we can even talk about that, and I have a few examples to show you.
All right. So talking about sports, mouth guards, what sports should they be wearing mouth guards for?
So I'm going to ask a different question. It's like you want to wear a mouth guard when you want to protect all your teeth.
Right.
Particularly the front teeth. So what we know is contact sports. So the football, basketball, soccer, hockey for mm-hmm. sure. But even the individual playtime sports like skateboarding. Mm-hmm. You can fall
really?
And take a fall and
Absolutely.
go down on your face and break front teeth. So, they're just as important. Or bicycling. It's probably not a bad idea if you're bicycling.
My son lost his front tooth in a bicycle crash.
Oh.
I think he was about 9, but he already had all his permanent teeth.
Yeah.
So that one tooth, it cracked all the way up into the gum. Yep. And the dentist was like, we could rebuild it. It cost you $10,000, yeah. Or you can pull it. Mm-hmm. And he was going to get braces anyways. Mm-hmm. So, but now he still doesn't have that tooth, and to get one of the implants, he has to have a bone graft.
Right.
So it's so important,
right.
especially at a young age.
Yes. You don't appreciate that the root of the tooth actually holds the bone. Mm-hmm. You think that we'll take the tooth mm-hmm. out. Well, once you take that tooth out, you lose the bone.
Yep, it deteriorates
around that tooth. Yeah.
So, what would be a good age for kids to start wearing the mouth guards? Like a very young age?
Yes, my recommendation is as soon as the children will mm-hmm. comply with wearing a mouth guard, and often so that might be 7 or 8. Mm-hmm. When they're playing soccer and they may have combination of permanent teeth and baby teeth still mm-hmm. in there. What I found really helps with wearing mouth guards is if the coach says you need to wear a mouth guard, the mm-hmm. coach makes it happen.
And cost is a big factor, right? About how much is the average cost for, say, like the over-the-counter? And you have a couple of examples.
Yeah, I have a couple. So the Boil and Bite, these are kind of the least expensive. Here, if you can take mm-hmm. a look, see. They're just a hard plastic. You put it in boiling water mm-hmm. for 30 seconds. Then you put it in cold water for about a second. So mm-hmm. when you put it in your child's mouth, you don't burn your mm-hmm. child's mouth. Have the child bite on it for about another 30 seconds so that it makes an imprint. These are the least expensive. These 2 were in a packet for $4.99.
Oh, okay.
So they don't fit well, but they'll get the job done
sure.
in terms of providing a cushion and protecting the teeth.
And now, is one for an upper and a lower?
No,
or
you
is
just
it just
need
an
one.
upper?
Yeah,
okay.
you just need one, so you get 2. So that's kind of 2
gotcha.
for $4.99. Mm-hmm. So it's actually a bargain. This one's a little more sophisticated, and on the inside it has a little more gel, so
mm-hmm.
it provides a little bit more cushioning. Again, it's the same idea. You just bite into it.
Right.
This was a little more expensive. This mm-hmm. was $11.99.
Okay.
So that's a little more expensive. The trade-off is they fit okay, but mm-hmm. not great. They're mm-hmm. very loose. What you really like are the ones that are custom made, mm-hmm. and they're custom made to fit your teeth. So if you have something like this,
oh, right.
the dentist would make that.
Okay.
And that fits around each, that's going to stay in place. Mm-hmm. And it's usually a little thicker material than that.
Suctions
This is
up
actually
to your...
suctions up to the teeth. That's exactly right. That will stay in place, but that's going to be a little more expensive because it's made by the dentist. So that might be $100.
And some insurance covers some.
Some insurance does. So the thing to do, I always tell patients, if you have insurance, first of all, the number one rule of dental insurance, if you have it, use it.
Right.
It's prepayment.
Right.
It's not insurance for a catastrophic event like your car insurance.
Right.
It's prepayment to help you get dental care. So, and then the dental office is usually very good at checking what benefits are included in your insurance. So they can check to see if a mouth guard, and maybe it doesn't pay for all of it, but maybe it pays for half.
Right.
So that helps. The other thing with mouth guards, if you start at a young age, mouth guards are kind of like shoes in children. They grow out of them because their teeth are changing. They're losing baby teeth, getting permanent teeth. So just like each new sports season, you have to get new shoes for the sport.
Right.
You probably have to get a new mouth guard.
And parents really should put that into their budget for the
the cost
you got
of the
pants
sport.
And ball,
Yes.
shoes and
The
gloves
cost,
and
and because I think the important part is it's prevention. If you lose the tooth, look at how much it would cost to replace that tooth, like you're seeing with your son.
Oh yeah.
Now
it's tens of thousands of
dollars for that implant
because there's a graft. And he could get a bridge, but again, still very expensive.
The issue with the bridge is you probably have two healthy teeth on either side, so you don't really want to cut them down.
Right.
So the implant is really the most conservative treatment because you just build the bone up and then put the implant, which acts as the root of the tooth, into the bone, and then put the crown of the tooth on top of that. But it's going to be several thousands of dollars.
And again, prevention, had he been wearing a mouth guard, but most kids don't when they're biking when they're young.
Oh, well, that's right. You don't even think about it, when you're out biking.
Until they lose a permanent tooth.
Exactly.
And so it makes sense that, health insurance or dental insurance, if they would, think of it, like you said, as a preventive. Because to lose the tooth or injure the tooth or the mouth or what, that would just cost so much more.
Exactly. I mean, to prevent the tooth, if the mouth guard's $100 or $200, and the insurance helps you pay maybe half of it, that's $100 relative to $2,000. Exactly.
Right.
So.
And what are the benefits of the custom sports guards?
So the biggest benefit of the custom sports guard is it fits better. So if it fits better, it's more likely to stay in the child's mouth. It doesn't flop out. These you put the little, they bite on it, but it's big.
Right.
So
bulky.
It's bulky. This gets in the way.
Uncomfortable for football players, I think.
Bulky and uncomfortable.
Right.
Yes. As opposed to this can be smaller and just fit the teeth, and because it's built on the suction, it'll stay on the teeth.
And that would suffice for athletics?
This would suffice. It would be it would be a little thicker.
Right.
This is actually a whitening tray.
Okay.
But it would be a little thicker, but it would cover the tissue much better. You can kind of see the difference.
And it covers the gums, right?
Covers
it protects the gums.
Yeah, it covers the gums too. But you can see the difference in how one is, contoured to the teeth versus there's a lot of room in there. So there's a lot of room for it to fall down.
Sure.
And if you're playing soccer or playing football, you don't want to be distracted by a mouth guard falling down. You'd rather have it stay in place.
And is there any other problem that can be caused by an ill-fitting mouth guard besides just
probably the biggest problem? That's right. The biggest problem of an ill-fitting mouth guard is children or adolescents don't wear it.
Yeah. And it just won't work.
And it
defeats
definitely
the purpose.
won't work. Yeah. And I actually think, from my perspective, not only is preventing the broken teeth or the soft tissue injury, but the ability to prevent a concussion is really critical, particularly what we're seeing in the NFL with the concussion protocol now.
CTE.
So if you've got, children, adolescents, playing youth football, boy, you really want to protect their brains as their brain continues to grow.
Absolutely.
So the custom mouth guard will do a much better job protecting against the concussion.
Yeah, and kids think that they're invincible. You know, nothing. I'll be okay. Nothing's happened so far, but it's the what
well,
it.
I mean, we've seen
Yeah.
young people be injured on football fields, so it really it's worth the protection.
Sure.
Yeah.
And is there any difference between, say, a mouth guard for football versus a mouth guard for basketball, or a sport that's less contact?
Yeah. Probably the only, I guess, hockey is probably the most dangerous for your face in general and your brain in general. So hockey protects the face, but they'll have a mouth guard, and then they'll have the the
it's
face
more
mask.
like boxing.
Yes,
So,
exactly.
They need
exactly.
a full
something, to protect the face. But basketball, football, soccer. Those are all the same.
And it just protects the gums as well as the teeth.
It does. It protects the gums as well as the teeth.
And your tongue, too.
Yeah.
Like if you were to bite down, just get hit the mouth, it would
absolutely
have to be really painful. And what about kids with braces? I mean, obviously, braces are a big investment, so you want to protect that mouth.
So the good news is the braces actually brace the teeth. The braces are going to keep the teeth in place.
Right.
If they fall, if your son had braces and fell on his bicycle, the tooth would still be in his mouth. The lips may be bleeding and the lips may be chewed up a little because of all the braces. Braces. Children with braces should wear a mouth guard too. And the dentist in this case is going to need to make the mouth guard, because even this, one says, do not use with braces. Because what happens is, the braces have little ins and outs. And what the dentist does is usually put, wax over them and then takes the impression and builds the mouth guard so that it's fitted to each individual tooth. But has made sure that you can get it in and out and not get caught on the braces.
Yeah, and protect all the wires if you have that kind of brace.
Yes. Yeah.
And you were saying earlier about replacing the mouth guard. How often is pretty standard?
So my feeling is you replace the mouth guard when it either wears out, it breaks, or the child grows out of it. The child's dentition changes, the teeth, they lose the baby teeth, get more permanent teeth, and now it's not fitting anymore. So then you need to, so if a mouth guard for an 8-year-old 1 year probably needs a new mouth guard when they're 9 years old the next year, because the teeth are going to have changed, the permanent teeth.
And is that a comfort thing as much?
It's a fit. It won't fit.
Okay.
So if you ever put a mouth guard in and it doesn't fit, don't force it.
Okay.
Don't force it, because you're going to wind up moving teeth.
That's a good rule of thumb.
Yeah. If it doesn't fit, then don't take it out and start over. Yeah.
Wow. Well, we'll be right back to finish our conversation with Dr. Neeson about using mouth guards at night for those who clench teeth and grind their teeth. But first, we're going to take a look at a very old public service announcement from the American Dental Association on wearing mouth guards. Stay with us.
This is an all-American boy. Almost. He's a top student, football player, baseball star, basketball hero. The girls are wild about him until he smiles. When he smiles, well, you see the problem. He forgets to wear his mouth protector when playing contact sports. Does your child wear a mouth protector? A public service of this television station and the American Dental Association.
Welcome back. We're continuing our conversation with Dr. Linda Neeson with the KCU College of Dental Medicine here in Joplin. And we're talking about mouth guards and the importance. And talk about people who clench their teeth at night or grind. How does that damage your teeth?
So first of all, people can clench and grind during the day,
not
as well just as at night. Yeah, one of the rules of thumb I always tell people is if you're sitting in a meeting and you find your fists clenched, chances are your jaw's clenched as well.
Sure.
Take a deep breath, unclench the jaw, unclench your fists, and just relax. But what that does is it wears away the enamel, which is the outer layer of the tooth. And what's unique about enamel is the hardest substance of the body, but it's also the only substance the body doesn't remake. If you break a bone, you cast the bone and the bone heals and it regenerates. If you break enamel, if you lose a tooth like your son did, the enamel doesn't grow back. You don't put a cast on that tooth and the enamel would heal. So therefore, we want to work hard to keep the enamel in place on the outer layer of the tooth where it was originally deposited, and keep it there.
So does it just wear away?
It'll
does
wear,
it crack?
Yeah,
What is
no,
that?
it wears away.
Okay.
That's it. So it wears. I mean, when we grind every day. When it's called chewing, right? But it's
The simplest form.
It's just normal. It's a normal activity, and that's what teeth are designed to do. When you grind, you're doing it abnormally, and that's wearing away the tooth surfaces. And you can see, I used to have the canines or the pointy teeth on the top. I used to have pointy teeth, and then I ground them away, and now they're
So you were a
flat.
grinder.
I was a grinder, and I loved it. It's like it felt so good. Until I realized what I was doing to the enamel on my teeth. So with night grinding, people don't realize they're doing it, or even clenching. You know, during the day, if you're clenching, you don't even realize you're doing it. So what we do in dentistry is we'll make a custom mouth guard for clenchers and grinders. This one is a little thicker. This is an example. And again, it's only designed to cover the bottom part of the tooth. So this is, it'll go on the top. Okay, and
I see.
So it fits.
It doesn't come up over the gums.
It doesn't come up over the gums. It only covers about half the tooth, and then it's flat on this side. So what you can do is you can just grind all around on it, and you're not going to wear. This is plastic.
Right.
So in a battle between enamel and plastic, the enamel is going to win, and the plastic will wear away instead of your tooth. Yeah. So the idea is you don't want to wear away the enamel. It'll just slide over.
Oh, okay.
The other thing that sometimes happens is that the way our teeth come together, the way the teeth work in pairs, the way they come together is we call that occlusion. The teeth occlude, which means they close. And sometimes the occlusion might be off. So your body is kind of fighting that to try to get the tooth to bite better. And in that case, you can go to your dentist. Your dentist can do an assessment of the occlusion and adjust if you have, some tooth that's in the way, and do what's called an occlusal adjustment. They'll adjust how the teeth come together so they come together in a more natural way that they fit, and they should come together. And that, in some cases, will help people stop grinding. So whenever you find yourself grinding, it's always good when you see your dentist to tell your dentist about that, so that the dentist can do an assessment to find out what's the cause and what the right treatment for you is.
My daughter-in-law used to, well, she probably still does, grind her teeth at night. And she got a mouth guard made, pretty expensive, and
Did it help?
Her dog chewed it up.
Oh, ouch.
That dog got in big trouble.
Oh, yeah. So the other thing is little children,
Yeah.
the children that are 5 and 6, when they still have baby teeth, parents don't panic. Because it's normal for little children to grind, and by the time they lose those baby teeth, they're often worn away. I've had parents come and say, "Oh my gosh, my child just grinded." It's like, it's okay.
Yeah.
When they get the permanent teeth in, they'll usually stop grinding.
Right.
So
is
don't
it
worry
just
about
because
that.
of the way they fit together? Or?
I think it's the way they fit together.
Yeah.
I don't know that we know.
Yeah, baby teeth aren't meant to be that way for very long, I guess.
Yeah. So, but don't worry about it. Yeah.
Should kids wear mouth guards? Little kids like that, or
no.
Okay.
Young children, if their grinding is normal, that's not a problem.
So just once their permanent teeth come in.
Once the permanent teeth come in, then you want to work to make sure that the enamel stays on those permanent teeth. Yeah.
And you were talking about the enamel wearing down. So protecting that, I guess some kids are born without enamel on their baby teeth.
Yes. That's an interesting point. There is a developmental syndrome that children are born without the enamel, the protective enamel on their teeth. In that case, we really need to work hard to keep the teeth healthy, because the enamel is about 70% mineralized tissue, so it's harder than bone, so it's harder to break down, so it's harder to decay than the layer underneath, which is called dentin. And dentin is about 50% mineralized tissue. That's about the density of bone. Bone is about 50% mineral. And then the other soft tissue is, blood vessels and nerves, that sort of thing. So the dentin, you have to work harder to keep the dentin decay free. So those are children who are going to want to see the dentist much more regularly. You know, maybe every 3 months, every 6 months, we're going to do fluoride on them, use maybe a fluoride varnish to protect the dentin to keep the children healthy. Yeah.
And so if they're born without it on their baby teeth, does that mean they won't have it on their adult teeth?
Usually. No.
Oh, yeah.
The syndrome, it depends on the severity of the syndrome, of the disability. And often if it's not on the baby teeth, it won't be on the permanent teeth as well. The other people who grind, you can grind in response to taking a medicine. You know, medicines can cause people to grind
like
their
a nerve
teeth.
issue or
a
something.
nerve issue. Sometimes you'll see people with like a tardive dyskinesia. They'll do this
right,
with
the
their fingers
twitching.
and the twitching. It can also cause them to grind their teeth as well, and that's somebody who would benefit from a mouth guard,
right?
Because they're doing it all during the day,
and they don't realize it because of their medication.
That's exactly right. Yeah.
Well, talk about the training dental students receive during the school.
So as the College of Dental Medicine develops, we clearly are going to have a curriculum where we're going to teach them how to make mouth guards. Prevention is really critical in dentistry, and prevention of dental injuries is just as important. So the process of learning how to make the mouth guard, we take an impression. Now we have impression materials, you know, which all the goop that you had in your mouth. We have that, but we also have digital impressions now. So we may be able to, you know, have the students learn, compare and contrast, taking the traditional impression with the goop versus a digital impression, making the mouth guards. And I'm sure we're going to need patients who would be happy to have mouth guards made.
Absolutely.
So it could be a football team, for example, at Missouri Southern, or
there you go.
a high school, Joplin High, or a sports, you know, just a sports football team. So yeah, so I believe the college would certainly be willing to make mouth guards for various teams, and here you have a fabulous hygiene program at Missouri Southern, so maybe we can partner with the hygiene program and do it in the hygiene clinic.
That would be incredible for a lot of kids.
Yeah, that would be great.
Do they use 3D printers when they do the digital impression? How does that work?
We have a CAD CAM, a computer-aided design, computer-aided milling machine that when you take the digital impression, you send the impression to the machine and it prints it. Yeah.
So they're going to learn everything.
Oh yeah, technology is coming to dentistry rapidly. The dental laboratory has really become digital over the last probably 20, 30 years. Yeah.
Wow. Yeah, and I saw, you know, a bunch of YouTube videos, and, you know, people, we're of the do-it-ourself, you know, age, and there's a billion YouTube videos. Would you say that if you can't afford to have it done by a dentist, is something better than nothing?
Well,
go ahead and do it.
Something is better than nothing. Okay, that's for sure. But I mean, just even if you start with the boil and bite, I'm not a do-it-yourselfer in terms of you finding the plastic material and you figuring, you know, don't go to those lengths. No. You know, there are stores that can help you.
Sure.
That might be the easiest way. But yes, definitely. And even if you have whitening trays, you know, if you've whitened your teeth, you know, here were the whitening trays. So you could wear, you can pop these in, you know, at night if you're grinding. They can help to stop, and you can see if you would wear. These are great to test whether you would wear a mouth guard at night.
Okay.
You know, before you invest in a mouth guard from the dentist, try your whitening trays, and most people use them at night.
Sure.
So that gives you a sense that you probably would wear the guard at night. Although, you know, and you can see it's a little smaller. If you can look at the sizes, we'll look at the sizes here. So here.
Oh yeah.
So you can see that this is the whitening tray, covers all the teeth. This only covers half the tooth. Okay, and then this this side doesn't really have anything. It's just the shape of the tooth where we flattened this side for the grinding so you can grind around. So.
And what do you think about like the mail order, like Smile Direct and places like that? Do they, I mean, is that I mean, I know you don't want to talk bad about anything in particular, but. So my feeling is I still think you need to see the dentist in person. Sure.
You know, everybody is different. My concern with the mail order is it's kind of one size fits all treatment planning. It's the treatment plan that's the same. When you go to the dentist and you talk to the dentist, and all of a sudden, you know, the dentist happens to say, gee, you're grinding. I haven't noticed you grinding before. And you say, well, I don't know why, and the dentist says, well, is your job different? No, I still have the same job. Children are the same, you haven't changed your lifestyle. And then all of a sudden, dentist says, are you taking any new medications? Oh, as a matter of fact, I am. And I think it's that personal touch that helps the diagnosis. Well, now we know you're grinding because of medications.
Right.
Let's see what we can do. I'm not a big do-it-yourselfer in the absence of professional, guidance.
Right.
Yeah.
Well, and talk about the update on the dental school, the construction. Where do things stand?
Well, first of all, thank you for asking. It's my favorite topic. The College of Dental Medicine is going well. We have a camera. We have 5 cameras outside, so you can watch them every day.
Time lapse.
Yeah, time lapse every day. They update it, which is great. The construction is on schedule. It's going. We put the foundations down. You're starting to see things come out of the ground, which is good, and it's still on target to be finished in April 2023.
Okay.
Then we'll equip it. April, May, June, we'll equip it.
Wow.
And then the students come August 2023. If all goes well, we're having an accreditation site visit to determine that we have all the pieces in place. So that's very exciting.
And you're still hiring
yes, well,
professors?
Not too many this year.
Sure.
As we get closer to 2023 is when we will hire professors to teach the students. But we have a kind of a skeleton crew now that's developing the curriculum and identifying what courses when, the sequence. We're working with the medical school faculty because they're going to help teach the basic sciences and the anatomy, and then our medical students and the dental students may learn how to take a history and physical together. We're looking at a lot of interprofessional opportunities with both the medical students and our doctor of psychology students, because in dentistry, in the dental clinic, people are afraid of the dentist. We know that dentists and physicians are effective helping people quit smoking. Well, our psychology students can help our dental students, help learn the sequence of asking the questions in the right way, so that it's not intrusive to the patient.
Well, and I had read a study that said, people who are afraid of the dentist, well, not all, but there's a number of things that have happened to you in your lifetime. You could be a sexual assault victim or something, and being, in that prone position, helpless basically, it is a white knuckle situation.
You are absolutely right. For some patients, it's a very defensive position, and it can be very scary.
Sure.
So the nice thing about having psychology faculty to teach our dental students how to address that and how to talk to the patient, how to ask the questions in the right way. The motivational interviewing is really important. So we're looking forward to those kinds of interactions with the other faculty and the students in those programs.
And we were talking earlier about dental clinics. So would there be, or could there be a plan to have a mouth guard clinic even, where you work with, even at Missouri Southern for that matter, and the area high schools, when they do sports clinics?
We're committed to community outreach. I feel like we are Joplin's dental school. The community of Joplin helped us build the school. So we want to make sure that we give back to the community. So having a mouth guard clinic would be terrific. We're looking for, the community outreach is an important part of our mission. Our mission is to improve the communities we serve. So we're really looking forward to improving oral health to improve someone's overall health as well.
That's great. So coming in 2023, I want to thank Dr. Linda Neeson for joining us today to talk about the importance of protecting your teeth when playing sports, or at night, or during the day if you clench and grind your teeth. This is Newsmakers on KGCS TV from the Ruth Copeland Studios here at Missouri Southern State University, and I'm Bobby Potroff. We'll see you again soon.